So there is a paper that was led by Dr. Susan Bartlett, specifically on influenza, and what were the frequency of people that at the entry to catch were vaccinated for influenza, and how many patients the next year. Approximately, there is 38% of patients that are at the time of entering catch, so very early after the diagnosis, receiving the vaccine, and that improves after they were part of catch. But the key concept of that study is that talking with patients about vaccines and sharing with them the importance of why do we need to get these vaccines increases the chances of the patient to say, oh, it's November, December, this is a time in which I need to get my influenza vaccine. So there are certain groups of patients that unfortunately were less likely to be vaccinated for influenza in the study from Dr. Bartlett. Those were people that were women and people that had different types of socioeconomic backgrounds, specifically non-white racial backgrounds, were less likely to be vaccinated. The good message from that study is that this can be improved. And I really believe that the key message in terms of vaccines is trust. So if you are able to generate that relationship with the patient of trust, and if the patient is able to understand and ask all the questions that are out there, for many of which we don't have answers, but at least we can share with them what it's the evidence that it's available, then the patient can make the decision, and it very often is a decision that is going to protect themselves. As we said, there's a lot of areas in which we do not have evidence, so we need to generate that. And how? Through research, through studies that are going to answer these questions. But on the other hand, what we do have in 2022, that they were published this year, the American College of Rheumatology came up with recommendations for vaccines in people that are immunocompromised. And these are recommendations that are based on current evidence and are going to be updated depending on how the new evidence evolves. So I think that we need to use that in a way as a springboard to then be able to tell the patients, this is what we're doing, this is why we're doing, and you can understand exactly where this recommendation comes from.